How to measure blood pressure. Measuring blood pressure accurately is a core competency for medical students, nurses, and other paramedicals. This is also important for home-based monitoring. This video explains the standard operating procedure, documentation, and assessment of this must-know topic. In the end, important links for source material are given, which one can download. This video has 3 parts. Part 1 is the actual measurement. Part 2 is the post-procedure counseling. And Part 3 is the assessment of skill and the resources. Part 1. You will need a stethoscope and a BP apparatus, which is also called as sphygmomanometer. If it is battery operated, check if the batteries are charged and it is working. Nowadays, mercury-based equipments are not used because of safety and environmental issues. If it is spring-operated, check if it is properly validated and the arrow rests to 0 before start. Use a BP measurement device that has been validated and ensure that the device is calibrated periodically. Ideally, these equipment should be checked for accuracy once a year. So this blood pressure one can see. After starting, check the battery level, and here check if it is at the 0. There are numerous different cuff sizes. Most commonly, it is the adult size cuff used for an adult. But if the patient is thin or small or too obese, you can change the cuff size, and this is the guideline for using the proper cuff size. But most commonly, we use the adult cuff size. Start the procedure. Introduce yourself to the patient, including your name and role. And if you are meeting for the first time, do this properly. Confirm the patient's name and ID on the case paper. Briefly explain what the procedure will involve using patient-friendly language. Gain verbal consent to proceed with blood pressure measurement. Prerequisites. The patient should be prepared for measurement. The patient should avoid caffeine, coffee, exercise, smoking for at least 30 minutes before measurement. Ensure that patient has emptied the bladder. Take appropriate history. Ask the patient when was BP checked last time and what was the reading. Is she taking any medication currently? If yes, what was the time last tablet was taken? Other history related to problem is usually taken before examination. Properly prepare the patient. Have the patient relax, sitting in a chair, feet on the floor, back supported. Do not cross the leg for at least 5 minutes. Neither the patient nor the observer should talk during the measurement. Ensure the arm is free of restrictive clothing. Remove all clothing covering the location of cuff placement if causing restriction. Wash your hands. Use hand sanitizer. Use PPE in appropriate situation. Protect yourself before examining a patient. Clean the earpiece and diaphragm of the stethoscope. This is important for the patient, especially at home-based monitoring. See, the patient is relaxed, sitting on the chair with hand resting on the table, palm facing upwards. Proper technique for BP. Support the patient arm. Use correct cuff size. Position the middle of the cuff on patient's upper arm at the level of right atrium. The marker on the cuff should be about 2.5 cm above antecubital fossa in the midline. Palpate the radial artery. Either the stethoscope diaphragm or bell may be used for auscultatory reading. Here it is shown the placement of the cuff and the marker. For auscultatory determination, use a palpated estimated of radial pulse obliteration pressure to estimate systolic blood pressure. Inflate the cuff 20 to 30 mm above this level. And for auscultatory reading, listen for caught cough sounds, which we will discuss in detail. Deflate the cuff at the rate of 2 to 3 mm of mercury per second. Note When the first two consecutive beats are heard, that is the systolic, continue to deflate the cuff and note when the beats disappear, that is the diastolic. Listen for 10 to 20 millimeter mercury below the disappearance of sound. Remove the cuff from the patient's arm. For digital apparatus, this procedure is automatic. At the first visit, record BP in both arms. Use the arm that gives higher reading for subsequent reading. Repeat the measurement after 2 minutes. In case of abnormal reading, take readings on other occasion before starting the treatment. Palpate the radial artery here, you can see, and watch for obliteration. After taking the blood pressure, wash your hands, use hand sanitizer, dispose of PPE kit properly if used, clean the earpiece, properly document the BP reading, systolic and diastolic. Note the time of most recent BP medication taken before the measurement. Average the reading, use an average of 2 readings obtained on 2 different occasions to estimate the individual level of blood pressure before starting the treatment. Provide BP readings to the patient both verbally and in writing. This is the Kortkoff sound. Phase 1, phase 2, phase 3, phase 4, and last phase 5 is the silence. Here you can see actually measurement of BP using electronic apparatus. The cuff is inserted and properly placed on the mid-arm with the mark on the cuff above the antecubital fossa, 2.5 centimeter or 2 finger above it. Palpating the radial artery, start the apparatus and see the point at which the radial artery is obliterated. The apparatus shows the BP which goes above this point and starts automatically deflating. You can note down the reading. The first part reading is the systolic blood pressure, the second reading is the diastolic, and the third is the pulse. This brings us to the end of part 1. This is the short revision of the different steps which we have taken. Introduction, consent, wash hand, position the patient, check the prerequisites, apply the cuff, check radial pulse, inflate, slowly deflate, measure the blood pressure and record, clean the earpiece and diaphragm, use hand sanitizer before and after, continue to deflate and check. Clean earpiece, leave patient comfortable, report and record. Next we come to the part 2, that is interpretation. There are special situations like pregnancy. Here the accurate BP is taken at each antenatal visit and documented and recorded. During the course of normal pregnancy, there is drop in blood pressure in the second trimester. So any rise in systolic above baseline by 30 mm of mercury and rise in diastolic above 15 mm of mercury is considered abnormal. Traditionally, blood pressure in pregnancy was measured in lying down, but now it is revised. It is desirable to change and take the BP in the sitting position. The Royal College of Obstetrics and Gynecologists have produced the guidelines for self-monitoring of blood pressure in pregnancy in March 2020. I have given the link which you can upload. There are recommendations checking blood pressure in the sitting position in pregnancy in home base. This is the guideline of RCOG of different levels of low, normal, high normal, raised and very high BP, and what action to be taken in case of home-based monitoring. There are new guidelines for in non-pregnant patient 2017 by American College of Cardiology and American Heart Association, and they have made categories normal, elevated, high blood pressure stage 2, hypertensive crisis. So this stage 1 and stage 2 are important. This is systolic and diastolic, systolic and diastolic. For stage 1, systolic or diastolic. For stage 2, also it is or, and for hypertensive crisis, it is either and or or. So these are the revised categories of blood pressure. There is also condition called as masked and white coat hypertension. Masked hypertension is when you measure in the clinic there is no hypertension, but at home when you do 24-hour monitoring, you will notice hypertension. It is the reverse in white coat hypertension. When patient comes in the OPD, because of anxiety or tension, there is a rise in the blood pressure, but if you check 24-hour blood pressure, there is no hypertension. This is very important for counseling the patient. There are identifiable risk factors which increases for coronary vascular disease and stroke. These factors are the factors which can be modified, and these are the factors which is not easy to modify. Cigarette smoking, diabetes mellitus, dyslipidemia, obesity, physical inactivity, low fitness, unhealthy diet. These can be modified, and lifestyle modification is important for prevention of hypertension. Tell the patient when is the next appointment for BP checkup, and risk assessment as per the blood pressure of the patient and history. These are important part of the counseling. Here is the list of advice about lifestyle modification and intervention for prevention. And these non-pharmacological interventions are best proven, like weight loss, healthy diet, reduction in intake of dietary sodium. This is very important. The ideal goal is to consume salt less than 1.5 gram per day. Enhance intake of dietary potassium. Most of the fruit contains the potassium. Physical activity like aerobic, dynamic resistance and isometric resistance. All of them help in reducing the blood pressure. Moderation in alcohol. Too much alcohol increases risk for cardiovascular and stroke. So these modifications must be discussed with the patient. Next we come to the part 3, that is the evaluation of competency by OSCE or Objective Structured Clinical Examination. Prepare a station for BP checkup. You can keep simulated patient or any healthy volunteer. Instruct the candidate on the written sheet that at this station you are required to take and record patient's blood pressure. Usually time for this station is 5 minutes. And this is the evaluation sheet which has the name of the task, perform adequately and completely, perform but inadequate or incomplete, and not performed at all. So there are different items on which one can assess the competency. The detailed link and the format is given in the description. The next part is the approach, attitude and professional manner which one can mark as per strongly agree and strongly disagree. This approach score is usually not added to the total score, and one can give a qualitative feedback to the student if he has done his job of checking blood pressure adequately or not. For postgraduate students, we can discuss clinical scenario with findings to discuss the management of the patient. These are the important links. You can download the links by clicking in the description on the YouTube channel. Thank you for watching. You can give comments and suggestions by email or writing in the comments. Please subscribe the channel for more educational videos.